Thanks everyone for joining us. I'm Gary Barker. I'm the CEO of Promundo US, and we're thrilled to welcome you to this webinar. Is COVID-19 getting us closer to equal, engaging men to achieve equality in care work? We want to start this event by honoring and commemorating the African American women and men victims of police violence in the US. We want to commemorate as well tomorrow, June 19th, called Juneteenth in this country, which is celebrated as the day slavery was at last abolished in 1865 throughout the US, and by calling attention to the unfinished struggle to end white supremacy in this country and the legacies of colonialism and racism that plague us not only here, but globally. We as Promundo and all of the partner organizations who are bringing this event to you today believe that intersectional feminism is not just an empty phrase or a conceptual framework that means nothing. It is to us a way of being in the world. It orients our actions and it demands that we stand for justice both inside our organizations and outside. And it makes us affirm that our work for gender justice is linked to racial, economic, and to climate justice. I think it's important to point out that I speak to you. The pixels you're seeing of me are from Washington, D.C., which is a piece of stolen land occupied by the Piscataway and the Powhatan, 75% of whom were dead, were killed within 40 years of contact with Europeans due to disease and war. And I think we must remember that historical legacy as we look at how COVID is affecting 2 to 3 times higher Latinx and communities of color in the US. I speak to you as a white male who lives on the stolen land. I speak as an advocate and a researcher. I speak as a father of a Latinx daughter, partner of a Latinx public health activist, both of whom remind me daily and hold me accountable to that privilege that I know that I carry. We think it's important to acknowledge that this day commemorates Father's Day. We celebrate the power and meaning of the relationships men have with their children and with others, and we use it to talk about the unfinished urgency of gender equality. COVID has made obvious the existing racial and gender inequalities in our country and globally. As 90% of the world's children have been at home, we've had as many people have been on lockdown, more people have been working from home and stuck at home. We've asked the question, are men doing more? Are we getting closer on gender equality? Promundo and Sonke started MenCare together with other partner organizations 9 years ago to look at this big gender inequality that women do on a daily basis 3.3 times the amount of daily care work. If we added up women's unpaid care work, it comes to $10.9 trillion a year if it were paid even at minimum wage. That an estimate from the International Labor Organization. That is bigger than the income of the 50 largest corporations in the world. So we created together in partnership with SAVE, with Oxfam and Plan and others to call attention to that massive inequality, to add our voices to the organizations that were already calling attention both to paid and unpaid care work. We've been reminded during COVID of the female face of the care workers on the front line, of the nurses killed because they were doing their job of caring for those infected or affected by COVID. Around the world, we know that of paid care workers, about 70% are women, often underpaid, harassed, lacking rights, and made invisible. And as we've used that word, invisible care work, we think it's important to say they themselves are not invisible. They have no magic powers to turn themselves impossible to see. We have made them invisible in the lack of our attention to those who do this care work every day. The partners who come together to bring this event to you believe that the inequality of care work is one of the structural drivers of gender inequality. That calling men in to do our share of care work as men is part of ending legacies of gender inequality, that it's a way to speak not only what we as individual men need to do, but also to call men into supporting the policies we need to support families every day, to vote for progressive female candidates, to achieve full paid care leave that all families need. Our research will tell some stories of men doing the care work. At the individual level, some households are achieving something closer to equality, but we'll also share how far off we still are. I'd like to show the first slide. Many of you know our State of the World's Fathers reports that we have shared and launched since 2015. Our 2019 report presented the framework that we use to look at policies, to look at the social norms that must change, to look at how building economic and physical security for families must be part of it, to look at how couples and co-parents thrive and achieve gender equality together, and finally to tap into the power of individual fathers and men to achieve care equality in the household. Next slide, please. From that report, we launched last year together with the Nordic Council of Ministers, together with all of our partners that collaborate in MenCare, what we call the MenCare Commitment, promoting men doing at least 50 minutes, close to an hour more per day, and to try to achieve and to get countries to sign on to a goal of men actually doing 50% of the daily care work in our homes. And the policies that we'll come back to later on that we need to do that. From paid leave that I mentioned before, to state-supported high-quality childcare, to full services for families so that they have both housing and education and access to living wages that they need to help their children survive. Policies in the health sector that we know are so much more urgent in the face of COVID, to starting younger, engaging boys and from early on to make clear that care work is not only something that women and girls do, but it must be equally shared by us from the earliest years of life. And then collecting regular data like this study that we're sharing today, so that we can call out inequalities, but also measure how we're making progress. With that introduction, I'm thrilled now to turn the microphone over to several colleagues. I'll mention our 5 speakers, our 6 speakers, and then, 5 speakers, and then we'll start first with Fatima. Pleased to introduce first Fatima Sumar. She's the Vice President for Global Programs at Oxfam America, joining Oxfam after a career with the US State Department, promoting in particular and engaging the US government around the Sustainable Development Goals. Next, we'll have Line Christmas. She leads the Nordic Council of Ministers flagship project, the Nordic Gender Effect at Work, and advises Nordic governments on projects to promote gender equality. Then we'll have Gabriel Corbo, who headed up Uruguay's National Early Child Care Program and is now a consultant working on public policies to promote support for care work. We'll then have Mpiwe Mangwiro, who is the Regional Campaign Specialist for Sonke Gender Justice in South Africa, and also leads some of the policy advocacy work for Sonke's work with MenEngage regionally in Latin America. We also have Wessel Vandenberg, who leads the children's rights and ending corporal punishment work for Sonke, and himself will share Sonke's global and regional advocacy work related to care and care equality. With that, I'm pleased to turn the floor over to Fatima Sumar to share with us the findings of the study that we did together and Oxfam's advocacy work in this space. Thank you. Over to you, Fatima.
Great. Thanks, Gary. Can you hear me okay? Good. Well, Gary, it's such a pleasure to be with all of you this morning. Good morning, good afternoon, and good evening to all of our distinguished panelists and colleagues who joined from all around the world. So, I'm always struck, Gary, I loved your introduction, by the way. I'm gonna have to think about how to do mine better, but I'm always struck, we do these fancy titles of our organizations. I'd love to introduce myself as just, Fatima Sumar, mom of 3 and overly tired. So that's how I really feel about my official description, often in the workplace. Yesterday when we were prepping for this session with my team, I was saying to them that already today, and I think we had only talked it by 11 a.m. Already today, I was trying to teach my kids algebra, geometry, run to the grocery store to find food, cook them lunch, and figure out, because I'm their new secretary for all their Zoom calls, how to do all of that. And it was already in between like 5 hours of meetings and trying to move some policy and program actions over the finish line. So I think this is a situation many of us find ourselves in. It's something, as you said, the statistics back it up. But what I really want to share with all of you today is there's a moment today with COVID-19, where we actually have sustained attention at a really personal level because it's being felt in so many households around the world of this issue of unpaid care, of unequal care, and the role that men and women can play. And so we have this huge opportunity here, and I want to share, I'm really excited to share the polling results that Oxfam America and Promundo have done. So I want to start by wishing all our fathers happy Father's Day that's coming up. You know, we're coming together today on a pretty historic day where we're launching the hashtag How I Care campaign. Please check it out, help us be part of the How I Care movement. And today we're really kicking off a campaign that elevates and celebrates the role of men in household work, childcare, and elder care, while we're pointing out that inequalities still exist. So the goal of our campaign is simple but profound. It's to encourage men to take on even more unpaid care work while pushing our governments all around the world to adopt policy changes that will get us closer to equal. So Gary, you did a great job setting the scene of how unpaid care and domestic work, things like cooking and cleaning and care for children or the elderly or the ill, these are often unrecognized, unappreciated, and undervalued tasks. And it's been like that for centuries, right? We all know that's been going on for many, many centuries in many of our countries around the world. So before COVID-19 hit, what do we know? We knew prior to COVID that our research at Oxfam showed that women undertook more than 3/4 of unpaid care work globally, right? More than 3/4 of unpaid care work. So since COVID-19 has hit, what has changed? Well, we know that substantial portions of the world population have adjusted to the loss of livelihoods, they're working from home, and they're caring for many children who have been out of school with the closure of schools. UNESCO tells us that nationwide closures today are affecting 60% of the world's student population, with most of Africa and Latin American countries currently under countrywide school closures. So we wanted to really test and see how have our responsibilities changed in the household during this unprecedented time that we're all living through. So together with Promundo, and we're really proud of our longstanding partnership with Promundo, we've conducted a rapid poll here in the United States to really understand how the situation is changing. Similar polling was also taken in the UK and Canada with 2 more focused surveys. We also undertook surveys in poor communities in the Philippines and in informal settlements in Kenya. So in the end, we surveyed over 6,000 men and women in about 7 weeks after the World Health Organization declared a global pandemic. Today, I am going to focus on the polling results in the US, but I want to really encourage all my colleagues here to read the report that we're releasing on Thursday, June 25th from Oxfam that will cover the results and be published from all 5 countries. Okay, so here's what we found. What I can say is that in all the countries we surveyed, men and women are doing more care during COVID-19, right? In the United States, 64% of men has said that this work has increased overall. And that's actually higher than the 55% of women who have said that their care work has increased. We knew prior to COVID that women were doing about 37% more unpaid care work, or roughly 2 hours more daily than men. So as people stay home from work and as children stay home from school, adults, we know that basic responsibilities are increasing, things like cooking, cleaning, childcare responsibilities. But our survey results found that not all demographics feel that equally. So 57% of white respondents said that their daily domestic and care work has increased. But 71% of Black or African American respondents, 74% of Hispanic or Latino respondents, and 79% of Asian respondents reported an increase. Asian respondents in particular were likely to report caring for supervising elderly relatives or dependent adults. Black or African American and Hispanic or Latino respondents were more likely than white respondents to report considerable time taking care of sick family members or community members. So these are added responsibilities, right? These are on top of everything else we all have going on in our daily lives: work, studies, paying the bills. We know that this is affecting emotional well-being. Nearly 40% of Asian respondents and 26% of Black respondents said they've had to give up or reduce during their paid work. So they're reducing paid work to take on these additional unpaid care work responsibilities. Food and shelter concerns were noted by 1 in 3 American Indian or Alaska Native and Hispanic or Latino respondents, and 1/4 of Asian respondents. So we're really seeing high numbers of food and shelter insecurity, in particular being felt disproportionately here in the United States by racial minorities as a result of COVID-19. 1 in 3 women said that they're getting sufficient rest, sleep, and time for self-care. And that's one of the most important things that they've had to give up. And I'm sure many of us, I know me personally, are struggling with that pre-COVID already. So are we moving closer to equal? That's the question of this webinar today. Is COVID-19 helping us get closer to equal? So here's what we can take away from the poll results in the United States. The good news is that men are doing more care work. They are. Our survey results show that. But they're not doing as much as women. The gender distribution of unpaid care and domestic work has not changed much during COVID-19, even though the work itself has multiplied. So we know that in the US, what we're finding is that men and women are perceiving their contributions of men differently. 2/3 of men are saying that they are cooking and cleaning as much or as more as women, but only 1/3 of women agree with that sentiment. And 50% of men feel that helping with children's schoolwork is equally shared, but only 30% of women feel the same. So, the good news is that men in all the countries we surveyed do seem willing to take on more care during this time. We are seeing shifts. We are seeing men wanting to take on more and taking on more during this time. So attitudes are adjusting, they are changing, and there's more and more recognition of how critical unpaid care is all around the world in the countries that we surveyed. But we know that this is a window, and the window may close, especially as life returns to normal, if and when down the line. So we want to take advantage of this window and really push policymakers to take advantage of this window. This is a moment we can bring about sustained change and new social norms and more equitable distribution of care between men and women. To do this right, we have to focus on people in communities most affected by this crisis. In the US context, this means Black, Latinx, American Indian, Alaska Native, and Asian communities, especially single parents, essential workers, and low-income families. It also means our work needing to really focus on better valued, paid, and supported types of care. So let me just sum up, and we'll talk more later during this webinar about what steps we can ask our governments to do. But let me summarize it as 3 calls to action here for governments around the world to consider. First, support paid sick and family and medical leave acts. Strengthen and expand workers' protections to include caregiving needs. Some countries do this well. Other countries are really struggling. Second, call for governments to take immediate action to ensure that existing childcare infrastructures survive the COVID-19 pandemic, right? We know that otherwise we're going to keep falling backwards. And third, push for parental leave to enable all parents, men and women, to care for their children and encourage all parents, including men, to be able to take it. So much more to talk about, Gary, but really thrilled to be able to work with Promundo on this research and to have this critical dialogue today in advance of Father's Day and for the launch of the How I Care campaign. Thanks so much.
Thank you, Fatma. Just to remind everyone who's participating and listening in, the report is available online, both at Oxfam US and at Promundo, so it's live today for those who want to look at the details of it. I'm thrilled, and we'll come back to those recommendations again at the end, and we'll have time as well for some questions. Turning over now to Line Christmas from the Nordic Council. The Nordic Council of Ministers. The Nordic Council has been particularly a leader both in building and supporting Nordic country policies around gender equality, and including within that policies to nudge and encourage and promote men's participation as equitable caregivers. The Nordic countries have been in many ways the champions of the most equitable parental leave in the world, in addition to other policies to go with that. So we're thrilled to hear results from the state of Nordic fathers that Promundo and Man in Sweden had the chance to collaborate on. So Line, over to you, and would love to hear from you the impact of these 20 years of policies in the Nordic region to promote men's participation as equitable caregivers.
Thank you so much. Can you hear me okay?
Yes.
Yes, and we have the slides, perfect. Hold on, there we go. You can go to the next slide. So thank you. Just to introduce, I am here in Copenhagen in Denmark, where I work for the Nordic Council of Ministers for Gender Equality. The 8 ministers for these 8 countries that you see on the map. As Gary said, last year we had the pleasure of working with Promundo and Man on the report State of Nordic Fathers. Our ministers commissioned the report because they wanted to inform their decision making with new knowledge on fatherhood and masculinities. And both Iceland and Finland have reported doing just that. Today, I thought I would share some of the findings, very few, but also some Nordic examples of the current crisis, if there's any light at the end of the tunnel, something positive to see. You can go to the next. So firstly, how are the Nordic fathers doing before the crisis? This is just a general picture. Fatherhood norms have changed considerably. Over the years, fathers have a much more obvious caregiving role. It's partly because almost as many women as men are in paid work. There's affordable childcare across the region. There is a generous parental leave scheme for both parents, generally with the ability to share 50-50. Fathers' share of leave has been increasing steadily to an average of 20%, in some countries up to 30%, largely thanks to earmarked non-transferable days. So we're not equal yet, and we're working for that. Next slide. Obviously, the Nordics are also dealing with a lot of questions around the impact of the COVID-19 illness and crisis. We can see already that the impact is gendered. We don't have a complete list of measures and their consequences, but so what I can say is preliminary. There has been lockdowns to various degrees, where both children and parents and everybody else had to do teleschool and telework. So I wanted to reflect on how 3 specific findings from State of Nordic Fathers align with the experiences of some parents during lockdown. If there's any positive effects on men's caregiving in the middle of an otherwise devastating crisis. So the next slide is, in the report last year, we found that most Nordic fathers believe that they and their partners share care work equally, but just as Fatima said, it's the same in the Nordics. Most women answered that they did most of the care work. And it shows this discrepancy of how women and men see and estimate care work. And this aligns with the next slide. It aligns with a survey made during lockdown by the Center for Equality in Norway in May, where they found that men, more than women, believe a lot of tasks at home are shared equally. It also found that women have the main responsibility for most unpaid work tasks, and that unsurprisingly, as we've heard already, women said that during lockdown, they spend much more time on the tasks that they already have the main responsibility for, which already is including everything related to children. So in this example, we do see the existing care gap being reinforced during lockdown. Next slide. The second finding I will highlight from the report is that when Nordic fathers have taken long parental leave, that's over 2 months, these fathers report wanting longer leave, and they also experience positive changes at home with their partners and kids, as well as at work. And this, I found, aligns with the next slide. It's a survey from Men's Health Society in Denmark, completed during lockdown, where over half of fathers said that they had played, talked, gone for more walks with their kids than usual. By far, fathers said that it had been good for them. So we can see that fathers have also taken a more active caregiving role during lockdown, and over half of fathers said that they will miss it when teleworking is phased out. So there's evidence of these positive outcomes if they have opportunity. Of course, this is far from every family or every father's experience. In the next slide, this is the last finding I'll mention from the report. It's about barriers. We found that Nordic fathers who took no or short leave are more worried that their colleagues and managers would not accept it if they were to take longer leave in the future. And I think this finding really emphasizes how the Nordics need to work with stereotypes as barriers, since it's not a legal barrier to ask for leave for men or women. The next slide. I think this finding links to a case study done by Parental in Denmark. They found that during lockdown in companies with teleworking parents, there has been more recognition of challenges related to caregiving, higher acceptance of flexibility at work, and perhaps with both employees and leadership showing more vulnerability as family people, it could become the new normal after COVID. And the next slide is some reflections. Based on the few surveys that we have so far, lockdown has had a positive effect on fathers, similar to how longer periods of paternity leave have had. So this is, of course, making a very careful hypothesis, but given the opportunity, imposed lockdown or a use it or lose it earmarked paternity leave, it can bring with it similar positive consequences on fathers and their involvement with children, with their children. Second reflection, if the experiences, it's still the same. If the experiences from COVID can help change culture and leadership in workplaces to become more flexible for employees with family responsibilities, then I think this can mean that there would be better access to parental leave for fathers who see work as the big barrier. And the last point is that we have learned in the past that inequalities are reinforced during a crisis, and that's why it's very important to keep an eye on the care gap and labor force participation, who is no longer registered. And I know the Nordic governments are doing this, so hopefully we can report on that next time. The last thing is the next slide. This was a really quick run through, but I do encourage you to go into our Knowledge Hub, where you can find much more context for the challenges and the work that is done in the Nordic region. So that's it for me. Thank you.
Thank you, Aline, for sharing those results, both from the State of Nordic Fathers report as well as the other emerging data on caregiving during COVID. And I'm sure there's lots of questions. There's already some showing up in the chat box that we'll have when we come to the question and answer period. I'm thrilled now to hand over to Gabriel Corbo, who's the former director of Uruguay's National Care System, which both oversees early childhood care as well as care for other individuals. While developing care systems seems ambitious and often overlooked by many countries, Uruguay has made some very important strides on that as an important example for both for Latin America regionally, but also thinking globally. And wondered if you could share how that care system works, how it was able to come together, and what lessons learned come from that experience. So over to you, Gabriel.
Thank you. Thank you, Promundo and organizers for the invitation. Thank you, Clara Aleman, for introducing us. Excuse me for my bad English. I'm going to try to communicate as clearly as possible. I made a presentation. Abda, can you share with us the slide? Okay. In our country, Uruguay, we were building a national system care. Care is present throughout our life, but the care from a public perspective is recent, despite the fact that they exist throughout the life of human beings. Next slide, please. The care has been invisible because it has been in families and in particular women. Next, please. In Uruguay, the care agenda comes from social movements, in particular from the feminist movements and from the academy. In 2015, the care system was defined as a priority with a law, and we worked in the first plan of care in our country. Next, please. We believe the care is a new foundation of the social protection. Our country have three basic foundations of social protection, and we believe the care is a new foundation of social protection across the other three foundations of social protection. Next, please. So, next slide, please. So, we believe the care is a right of the people with dependency. It's a right that promotes gender equality, serving people in situation of dependency. A care system in the public agenda is necessary because it's a right, promote the gender equality, redistribution and social sustainability. Part of the problem of the sustainability of the social security system is solved with a system of care. The absence of care policies limits the performance of women in the labor market. Next slide, please. The criterion we have used to determine when people need care is the dependency. Dependency is when the people need to receive assistance, total or partial, to be able to carry out activities of daily life. So the dependence have different levels. The next slide, please. The levels of dependency determine when people need different service. In our country, we define 4 population for the system care. childhood, elder people, disabilities people, and the caregivers. Next slide, please. In particular, in addition to a right, is a social function, because that is why we work with caregivers. It's necessary to give social value to the work. The caregiver is priority, is the quality of the job. Next slide, please. So, a national system care is not only service. It's necessary other components are required other components. For example, the regulation of the market labor to the tax of care, the training for the caregivers, the communication to promote a social change, information and knowledge management. This for us, this the main important components of the system. Next, please. The principle of the system is solidarity, co-responsibility, autonomy, and universality. I want to explain the co-responsibility. For us, it's very important, the co-responsibility. We believe in the importance of a cultural change that is based on shared responsibility, co-social and gender responsibility. Next slide, please. The co-social is a cultural contribution to share the care with families, community, state, and market. And the gender co-responsibility is the equality distribution to the care between women and men. Next, please. The gender co-responsibility, promotion of a new common sense of overcome the sexual division of labor from a gender perspective. This is a difficult task. It's necessary a cultural change. We need a study of the evolution of social representation of gender and care, and a study on the use of time. Next slide, please. Today, the system has important challenges. First, the political sustainability. There has a Chinese political orientation, and we still do not know if they share the principle of the system of care. The COVID is a pause in this orientation. We don't know if the system, the care system, will be continued in the future. Economic sustainability is very important. Today is sustainability with national budget. And the most important for us is the cultural change, work for the co-responsibility. Is not only create a new service, the new service must be shared with a cultural change with the co-responsibility. And this is the most important challenges. For example, recently in North, we see the 20% of men participate the leave. In Uruguay, only 2%. Well, Before, there's nothing, only 0. Now it's 2. Perhaps in the future will be increments, but increment this percent is only possible if we made a cultural change. Okay, it's all for our. Thank you.
Thank you, Gabriel. And I'm sure we'll have questions and comments at the end, particularly asking about, what it means to put in place a system like that in terms of cross-agency and putting a national budget to it, et cetera. We're all curious of how we take these issues into public policy. So we'll have more comments and questions as we come back. I'm now pleased to introduce and present Wessel Vandenberg. He is the Children's Rights and Positive Discipline Manager at Sonke Gender Justice in South Africa. And I also want to note that Wessel is one of the co-founders of MenCare when we started it 9 years ago, and he currently serves as co-coordinator of the MenCare campaign globally, together with Aptegarg, Senior Program Officer at Promundo US. Wessel, over to you.
Thank you so much, Gary. So I'm the father of 2 young children, and in my spare time, I work at Sonke Gender Justice and also on MenCare. And the co-coordination is actually falling to Mpo at the moment. I've passed the co-coordination, Gary, so it's nice to be more involved in a different capacity at this stage. I'm going to present a few snapshots of what's going on in South Africa in terms of care and COVID. This is not by any means a representative study, but it is some pieces of information that we are able to collect. I agree with Fatima from her presentation that this moment presents to us an opportunity, I think, to observe the lack of an ethic of care, to use the feminist and political term of an ethic of care, but also an opportunity to see if this moment might be an opportunity to foster such an ethic of care. The first slide, please. Currently in South Africa, let me first speak about the distribution of care work in terms of gender between men and women. We have, from our latest time use data, which is actually quite old by now, we have information that for every 1 hour of time spent on unpaid care work by a man, 8 hours is spent by a woman. So we are very much behind, the global average of 1 versus 3 is quite a problem, but in South Africa it's even worse. In terms of services for children, in our lockdown, which began at the end of March, all of our childhood development centers and social and support services were closed. And we have a national helpline for children called Childline. And it was really striking to see that they received almost double the number of calls compared to April in 2019, a year ago. And the top 3 reasons for children calling in were that there were requests for information about social support, social grants, and food parcels. And there were concerns about physical health, assumedly in the context of Corona and COVID, and there were reports of child abuse. The next slide, please. So if you consider the constellation of care in South Africa, especially household care work, so not a state care provider or institutional healthcare provided, you cannot ignore the major workforce of domestic workers. And we received some findings from a small survey done by a Domestic Workers Alliance, who showed that firstly, the domestic workers, there are about 1 million domestic workers in South Africa. Most of them are women, and most are primary breadwinners for their families. Only 37% of them kept their income during the lockdown. So not being in the homes where they were providing the work deprived them of the actual income that they had. At the same time, it's a statutory requirement for employers of domestic workers to arrange for unemployment insurance. And just over 90% actually did not have this unemployment insurance arranged. So I think South Africa presents us with an interesting picture on paid care work and the precarity of care work, even when it is paid care work. So two quotations. The first one is, they told me I have to work until that 20 days, the first period of lockdown. Sitting with them, they refused to let me go home to take care of my kids, to make sure my kids are safe. The second one, I was stopped from coming to work because of coronavirus until further notice. Was told to rent a place close to work so that I won't take public transport, or else I have to look for another job. So it shows very much the issue of class inequality and class disparity in terms of experiencing and dealing with COVID. And I think amongst the middle class, the blindness that comes with privilege, or the epistemological ignorance, to use lots of syllables, was removed from the middle class when the middle class had to do this work for the first time. But at the same time, as we see here, it left those who were doing that work and who value that work in quite a precarious situation. The next slide, please. So this slide comes from a social attitude survey done by the Human Sciences Research Council about social attitudes. It's done annually. The Human Sciences Research Council supported Sonke and worked with Sonke in producing the first State of South Africa's Fathers Report in 2018. And we were also involved in advocating for paid parental leave to be improved for all parents. That improved parental leave has now been activated, so fathers can now access 10 days of paid leave from the 1st of January 2020. And the social attitude survey took the opportunity to ask questions about attitudes towards leave in 2019. As we see from the chart, there is overall support from both men and women for paid leave to be taken by fathers for care for children. The ideal period most cited was 3 to 4 weeks. But there's an interesting discrepancy where, if you look at the last chart, fathers, and we asked, fathers will use parental leave for other reasons not related to parenting. Quite a large proportion of men and women agreed that fathers will use the time for reasons not related to parenting. So the myth or the norm that fathers will go fishing or do something else is still out there. We do not have data on uptake yet. It is still too soon. In the next iteration of the State of South Africa's Fathers Report, we will collect some information on uptake, and we will launch that in June 2021. So we look forward to comparing the norms versus the actual uptake of parental leave. Thank you so much for the opportunity. I will now pass to my colleague Mpiwa Mangwiro, who is from our regional policy team, and she will speak about some of the work happening in the regional context in sub-Saharan Africa. Thank you.
Thank you so much, Vessel, and hello everyone. Good afternoon, good morning, good evening. It's a pleasure to be here and to also be able to share some of our regional experiences around parental care work. So as Sonke Gender Justice, we are part of the MenEngage Global. Next slide, please. We are part of the MenEngage Africa Alliance. We are the secretariat of the MenEngage Africa Alliance, and MenEngage Africa Alliance is a region. It's a regional alliance which is part of the MenEngage Global. And MenEngage Africa is the fastest growing regional network with organizations from 22 African countries. We work in partnership with civil society, with public organizations, decision makers on the progressive and proactive engagement of men and boys in the areas of health, gender-based violence, HIV and AIDS, SRHR, parenting and human rights. The network promotes collaboration and resource sharing among organizations and institutions, builds capacity and leadership, and supports joint advocacy and policy initiatives in sub-Saharan Africa. So parenting is one of the areas. We did some policy scans last year. We were amongst, because we work, as I have mentioned, we work in sub-Saharan Africa mainly, and we're doing some policy scans in terms of our focus areas. We did this in 6 countries that we work with around the issues of GBV, HIV, AIDS, SRHR, parenting, and human rights. And I'm going to share with you some of the findings that we found, just a snapshot around parenting, around the laws and policies that are there in terms of parenting. But before I even do that, I wanted to start by saying that this is a very, and agree with other panelists who've spoken, Fatima and Vessel, to say this is a very important conversation around care work, for us to take time to really reflect and see what is happening in that area, and also maybe to give us an opportunity to reflect and rethink how best we can do that. And I glean on an experience that I had I'm a new mother. I'm a mother to a daughter who is 11 months old. And when my daughter was born last year, the legislation on parental leave in South Africa did not yet exist. So only a mother, an expectant mother, could take 4 months maternity leave. That's what was there in the country. But even in terms of the South African laws, employer is not mandated to pay an employee during that time when they are on leave. A mother can then apply to the unemployment insurance fund to get that. But fortunately, my organization, I was on leave and I was being paid. Then my husband was not get leave, because even the 10 days parental leave that is now legislated was not yet in place. So when our baby came, she was born prematurely and had to live in hospital for some time. Unfortunately, my husband could not go on leave because there wasn't that provision, and at his workplace they told him that you're not able, you can only take a few days from your annual leave. If you go beyond that, it's going to be unpaid because there's no provision for parental leave. So what that already meant was the burden of care was transferred to me, because I'm the one who was then responsible to move around. I just had a C-section and I needed to move around to go to hospital to see the baby. I was not able to drive myself. And then now you'll find that you're looking for assistance. And the assistance that I was looking for, I had to call on my mother. I had to find domestic assistance, domestic help. But all these are women. And that's when I realized how entrenched this norm of child care work being a responsibility of a woman is. And I think this needs and I realized that there's really more work needs to be done in terms of rethinking this, not just from how we do it at home, but also even challenging the systems, our economic systems and institutions, to be able to address this gap, because it continues to communicate and send the message that child care work and unpaid care work is the responsibility of women. And we already see that it is costing a lot for women to do that, while men are not as equally involved. So having shared that, I'll now go on to just give a snapshot of some of the findings that when we did the policy scans that I've explained, that we looked at issues. Parenting was one of the issues that we looked at, and we really wanted to see what legislation is in place when it comes to parental responsibility, and particularly parental leave for men to be able to be fully involved in the care of their children. Next slide, please. So when we did this, I've just shared from 5 countries, the first one being Kenya. So when we looked at Kenya, we saw that according to the Kenyan Employment Act, men are provided with only 2 weeks paid family responsibility. And that is the only time that's the only time that they are able to take to go and attend to their parental responsibilities. On the other hand, a female employee is entitled to 3 months paid maternity leave. But neither a woman or a man is provided with emergency-related leave according to this act. And it does not state specifically if men can go on maternity leave to be part of the child's birth. even though this is potentially covered within the provision of the paternity leave. So what this means is that the woman is given a much bigger responsibility and a much bigger burden of care, and more than the men, because 2 weeks is not enough for a man to be able to be fully involved in the care and nurturing of their child. And it would be better if the leave could, if the legislation could make room for more time to be afforded for men to be also involved, because otherwise it continues to entrench that notion that women are the ones who are more responsible for children and for caring for their children. Then we also looked at Namibia, and we saw that while men are legally required to support their children, there is no provision for parental or paternity leave to support fathers to become involved in their children's lives from birth, as well as supporting the mother. And similarly, like the situation in Kenya, what this means is that the responsibility is left to the mother. And also, even though in terms of when you look at the Maintenance Act, it says that maintenance of the child whose parents are apart lies upon the non-custodial parent, either the father or the mother, and it does not matter whether the child is born outside marriage. However, this looks more at a resource, the resources financial side. It does not address the issue of the physical presence of fathers being able to play their role and being able to take care of their children. And same applies to Zambia. No parental leave for fathers currently exists. The draft constitution alludes to paternity leave, but this is not yet law. And also the Tripartite Consultative Labor Council, which is a representative body of workers, employers, and the government, has recommended for an unpaid paternity leave of up to 7 days. This presents challenges for fathers to be able to be involved in the caring of their children. Also, this also presents a major challenge for fathers who are low-income earners who may not be able to afford even take that 7 days away from their work if it is not paid for. So similarly, the notion of continually placing the burden of childcare in the hands of women continues to be entrenched in these laws. And in the Democratic Republic of Congo, the Labor Code provides for 2 working days paternity leave, which is insufficient for a father to be fully involved in the care of their child. And also, it doesn't make much room. There isn't much room in specificity if a father is able to take emergency leave outside of the 2 days for them to be able to also be still involved in the care of their children. We also looked at Tanzania, and in terms of the Employment and Labor Relations Act, it stipulates that fathers are entitled to 3 days of paid paternity leave if the leave is taken within 7 days of the birth of the child. Further leave will be classified as unpaid leave. This again is not sufficient for fathers to be actively involved in the care of their babies. It continues to entrench the norm that women should be primary caregivers. So from the countries that we looked at, we found that there is a common thread that either there is no room, there is no mention of paternal leave, and where it's mentioned, the days are very minimal and they make it difficult for fathers to be able to be actively involved in the care of their children. And what then that means is that women are the ones who are often left to do unpaid care work. For instance, if you look at also in South Africa, you find that the maternity leave, employers are not really obligated to pay their employee, which means that there are instances where people go on maternity leave for 4 months and it's still unpaid, and they have to claim from unemployment insurance fund. So you find that the thread where women continue to be the major caregivers or the primary caregivers of children comes out as a thread that is flowing across a number of the countries that we looked at, and we think that there is room for this to be addressed by the legislatures, and we we've taken this, we've identified these gaps as part of our advocacy initiatives to then engage with the different countries, lobby them to address this gap and work on providing more days for fathers to be also involved in the care of their children. Thank you.
Impiwa and Vessel, thanks very much for those for those presentations on both unpaid and paid care work, and thanks for the policy scan from Sub-Saharan Africa, where we see just the gaps still needed to promote the kind of care infrastructure that we need to get to equal with men's participation at the household level. I'm now pleased to hand over to Brian Heilman. Brian is a senior research officer at Promundo and has led Promundo's research on the How I Care survey that we did together here in the US with Oxfam, and also led work on the last State of the World's Fathers report. And Brian, maybe you want to comment as well how the scan of parental leave policies in Sub-Saharan Africa compares to globally, in addition to some of the other questions. So Brian, over to you.
Yeah, and thank you to all the attendees who have been sending in questions. You can continue to do that. It looks like we have in our agenda about 15-20 minutes to follow up with any of the panelists. And if the panelists want to come back on video as you're responding, or just in general, I think that might help. I'll do my best to work through the questions that have already come in and still keep an eye on any new ones coming. There was an early question that came, and I wonder if perhaps Lena could speak to this, or even Fatima, and that's about any attitude change that's associated with men taking on additional bits of care work. You know, if they're getting more involved in that work around the home, do they come to appreciate it or feel any differently about that work? Would anyone like to speak to that?
Yeah, I can answer from what we found from State of Nordic Fathers, which was the attitude change after long parental leave for fathers. The fathers who had been on leave for over 2 months had a clear change in attitude compared to the fathers who had taken no or short leave, so none or no days or up to 14 days, I think it was. And because we're looking for that like irreversible change, that when does that happen? And at least in the report, we could see a big difference after 2 months of paternity leave.
Yeah, that's great to hear. I think the idea behind the question, I think, is that hopefully the more that men experience this work and contribute in equal terms, they'll come to see it as valuable. And that means both that they would appreciate and be eager to do more of that work themselves, but also to recognize the contributions and the real value being added to the family by any other folks who in their families have been doing more of the care work. It's good to have that substantiated, that hunch substantiated with your data, Lena. Thank you for that. A couple other questions came about, okay, we're talking about a very particular moment in time right now amid COVID and a lot of social distancing measures that are putting folks into the house and maybe resulting in an increase in overall care work, and men being a part of that overall increase. And so then questions are coming about, okay, as society starts to open up again, as other care resources such as childcare or hospitals and just schools come back open, is there a risk of losing any gains that may have happened during this time? And I guess what would any of the panelists suggest we do to continue to build on any positives and to even push for broader changes at structural levels? And maybe I'll allow Fatima to speak first about just what you would call for in the US context as we go forward, and then any other panelists to speak to your country and regional context.
Thanks, Brian. Appreciate it. And thank you for the tremendous partnership we've had with you and your leadership. So, you know, I'm struck during this time, right? Like we're in this new normal, things have changed. And the question we all have is how much of this sticks, right? On multiple dimensions and multiple fronts when this is over. So, you know, for me, the way I see this challenge across different sectors is we have a moment today to build back better, right? We don't actually want to go backwards. We don't actually want to go back to pre-COVID times on a whole host of issues. We want to build back better and use this moment and use the learnings from this moment. And you know, the research that all of our work has shown across the world is there is this opening. Things are a little bit different. Men are doing more. It's not equal, it's not the same, but they're doing more. And at least personally, they're feeling it more, right? So how do we seize that moment? Let me talk about here in the US, when we talk about greater policy changes and more sustained change and how to take advantage of that moment. So in the United States, Congress passed during COVID-19, Congress passed the Families First Coronavirus Response Act. And it was amended by what we call the CARES Act. And it included provisions on paid family and medical leave, paid sick days, funding for childcare, and cash transfers. This is the first time in the United States since 1933 that the federal government has passed any legislation on paid leave. And with this act, Congress is requiring federal paid leave for private sector workers, almost 30% of whom, which is we're talking about more than 32 million people, have lacked access to a single paid sick day prior to the passage of this act, right? So that in the US context is a pretty seismic shift on how we think about an issue like that. And it's a good start. But it's not good enough or far enough. And so we do have this moment to say, let's build on that. And how do we expand it for longer periods of time and to ensure that this paid leave is available to all workers? So let me offer 7 practical things in the US context, but I wonder how much they apply listening to these incredible presentations and the research to many countries around the world. So 1, and I'll be very simple about it. 1, we need parental leave for all parents, right? All parents, and working on legislation that really ensures what that looks like, and that it's a supplement to maternity leave, but not an alternative to maternity leave. Because we all know it's not just when you have the baby, it's even things that come after, as we all know, as we're raising children, what we're seeing today. 2nd, paid sick family and medical leave, right? We know that we need to ensure that all individuals have access to this. We have to strengthen and expand workers' protections to also include caregiving needs. That really is just not the norm in most of our societies today. 3rd, really making sure that we have increased amounts of paid leave and that they're paid at 100%, and that paid leave can be taken for a wide variety of reasons. We all know, we're all feeling that today as parents, as caregivers today. We know that we want to be able to take leave intermittently, in short bursts, short increments, in hours or as days as needed to have that kind of flexibility. 4th, really looking at protecting our childcare infrastructure. I mean, look, when 60% of schools are closed all around the world, when you have the majority of our childcare facilities closed right now, even as we're reopening in our societies in different phases, many of the restrictions being put back on childcare facilities, in some cases, may feel so expensive and onerous that they shut down completely. What does that new normal look like for us as child caregivers? So really making sure that we're protecting our childcare infrastructure, our facilities, making sure they're equitable and equal access for all, and that they're the high quality that we all want to see. 5th, this is a moment, what the research is showing is that this is a moment to challenge our norms and sexist beliefs around care being women's work only, right? That is what we are seeing. There's an opening because more men are now involved because they have to be, and they're seeing it too, and they're feeling it too. How do we really challenge the norms and those beliefs and make that really rethinking our societal norms individually in the countries we live in and globally around the world? 6, flexibility, we all, what our new normal right now is showing us as we telework, as we figure out how to do it, how much we value as individuals and as societies flexibility of our schedules, of our hours. Do we have to go back to 9 to 5, Monday through Friday in these rigid ways of working? Can we think about new norms, new ways of working that allow us to actually fully be parents, to fully take care of needs around the house, and to value and equalize unpaid care work? And 7, social protection programs for caregivers. We know the incredible work caregivers do. We've just spent the last hour talking about how most of that is unpaid and not financially valued by society. So really making sure that social protection programs, and I want to be clear, this could include cash transfers or providing income support for shorter term and longer term periods of unemployment. But we want to make sure that they should benefit parents and caregivers in recognition of these critical roles. So, you know, Wessel, you said this really well. I loved how you said that this is our moment to foster an ethic of care. How do we take that moment, though, and institutionalize it through sustainable policy changes that allow us to build back better? Thanks, Brian.
And any other panelists feel like speaking to or have a kind of burning comment about if there is ever a new normal or a back to anything resembling normal and some of those additional care sources are there, just what would your top couple points for sustainability of any positive changes be?
Thanks, Brian. I think this also overlaps with a question that Rachel asked, which I think is a really good question, whether in the context of COVID, we saw a possible connection between, or you saw a possible connection between increased care work and less risk for gender-based violence. That relationship is more complex than it has been. It sounds intuitive that more washing of dishes will lead to less violence, whereas it's more that people who are likely to wash dishes are less likely to be violent, for example. But I'll let you answer from the research if there was anything on that. I think just something I neglected to say about South Africa, which is really important, is we saw a massive confirmation of the fact that alcohol is associated with gender-based violence. With lockdown, we had a full prohibition of the sales of alcohol and tobacco for the whole period of lockdown. And as we were phasing in, returning to a more engaged society, we saw the lifting of that restriction on the sale of alcohol and a very clear concurrent increase in gender-based violence almost immediately. The data on violence, gender-based violence during the lockdown is conflicted. Some analysts saw a decrease, some analysts saw an increase, depending on which sources you look at. But what everybody agrees on is if you add alcohol back into the picture, it increases. Obviously, we can't maintain full prohibition, as we saw, but it just shows us that we need to put some measures in place that regulate or manage the consumption of alcohol in ways that would keep the violence down.
You're a great co-moderator, Wessel, because I was hoping to shift to this conversation about any links with IPV as the next direction, and I appreciate the comments that came in. From specifically the US survey standpoint, I think we also substantiate what you're saying just now about links or just the current moment and the additional stresses coming from living under this unprecedented moment means that those places that people go in response to stress, whether it's drinking or just like conflict and criticism in the household, at least in our US survey, we saw some or like a high proportion of people who said that they were experiencing conflict and criticism in the household and using alcohol more often, like in a current moment, than compared to a normal week prior to COVID. So I think there are a couple of complex relationships happening. That certainly a more equal, less violent relationship would probably also be marked by greater sharing of care work. But also we're living through something that we know in society to be a trigger for a lot of these stresses and other behaviors that link with violence. In the interest of time, we have about 10 minutes maximum more for questions. I wanted to share another great question that came in, and this is a bit of a turn now, but someone asked, they're wondering what policies or ideas there may be to encourage corporations to be active players in breaking gender stereotypes and providing safer space for men to take parental leave. So that relates, Lena, to some of what you were saying, but I wonder, even thinking about the Nordic setting and others. Would anyone like to speak to any of our corporations on the line?
Brian, I can comment on that if it's appropriate. Promundo, together with Unilever, and particularly their Dove Men Plus Care brand, have been working with a number of global corporations, Facebook, Twitter, Bank of America, Deloitte, and some others, looking at what kinds of corporate policies make sense, because it's quite clear, both in the State of the World's Fathers report, our own research, State of Nordic Fathers report, how even if corporations offer parental leave and paternity leave above and beyond what's available in a given country, the biggest barrier seems to be whether men worry about how they'll be seen at the workplace. And that has certainly been one of the biggest barriers for women, mothers taking leave historically. So men are facing some of the same challenges, certainly in far different ways, but we see that even when men are comfortably and apparently well employed, they worry about their salary, they worry about how they'll be seen in the workplace. So we're absolutely clear that whatever statutory or policy changes, whether within a workplace voluntarily or even better when those are part of law, that the norm change has to be there. We've got to engage the world around men and women that says, we support you in taking the care, your job will be here, you will not suffer, this is normal that you take time off. So that campaign is working to precisely do that, to build in approaches from HR departments, communication materials, telling the stories of parents of all kind being able to take leave, both sick leave, family leave, leave with the birth of a child or the adoption of a child, and connect that to their work lives with no penalty, and in fact for them to be seen as thriving. So absolutely agree, and thanks for asking that question.
I wonder if I could bring Mpiwa into the conversation, only if you're willing to take on a couple new questions on a similar theme that have come in, and that's about just these discrepancies reported by men and women in various kinds of surveys about how the care work is shared and really how much each person is doing, and that really there's a shortcoming, and perhaps a particular shortcoming among men, to be able to see the true extent of care work, and that there's a kind of a mental load of planning events and looking out for families' care work needs in advance. Can you speak, Mpiwa, to anything about just what you've seen and experienced with regard to who sees the amount of care work more accurately, and what are the kind of most overlooked forms of care work?
Thank you. Yes, just to say that care work is generally seen as a woman's responsibility. It's associated with women, and there's this way of invisibilizing the weight of care work. It's almost taken as it's something women do because it's natural. That's how women have been, that's how women are wired. It's as if there's this assumption that women are wired in such a way that when it comes to taking care of a child, they even say the nurturing instinct or the mothering instinct, something that it's made to be something that is ingrained in women and something that women can automatically do. When you realize that this is all learned behavior. If no one is born knowing how to take care of a child or how to fend for, like to nurture a child, even a woman who's carried that child for 9 months still has to learn how they're going to feed that baby, how they're going to bath that baby, how they're going to take care of that baby. So this is learned behavior, but because of our gender norms and which have entrenched and framed it as something that is woman's responsibility. So you find that men also tend to take it for granted that it's women's work, and you find that even where young women or where young mother needs support system often comes in the form of their own mother, or at least if you talk across many African cultures and contexts, it's a mother who comes to support their daughter in taking care of their child, still passing on that trail of it's a woman's responsibility to do it. And you find that if we're talking now within the period of COVID-19, you find that when we went into lockdowns, many countries went into lockdown, the issue of kids stopped going to school. Who has been taking care of the kids? Still women who are responsible for taking care of kids, making sure that they are fed, they are cleaned up and all that. And if kids fall sick, the burden of care work, even taking care of people who are sick, often falls again into the hands of women. They're the ones who are responsible for that. We're talking about some of the WHO regulations that say wash your hands often and so forth. You find that there are many communities that do not have access to running water. And who goes to fetch that water from wherever they get it? It's still a woman who does that. So at the end of the day, a lot of the care work around the household, around taking care of people who are sick, around taking care of children, babies, it falls under it's women and young girls who do it. And there's a tendency to, but while women and girls have been socialized into also thinking that it's their responsibility. So you find that even it's passed on from one woman to the next. And also, so at the end of the day, women and girls really carry the bulk of the burden of care work. And I think until we went into lockdowns where we are beginning to see men also be exposed to that, it has always been this notion of taking it for granted is something that is easy to do. Is that's why we even call women who are not in formal employment. You hear someone saying, "I'm unemployed," because no one recognizes that a care work is work. So it's like if you are not in formal employment where someone is paying you, you are unemployed, and the assumption is you are not doing anything, whereas you are doing so much work, and that's the reality.
Thank you so much, Nkiwa. That was really fantastic overview. And I want to turn to Gabriel at least once in this discussion section and wonder, Gabriel, if you have any thoughts on how a government program of care equality can address some of the things we've talked about, can address these gender norms and stereotypes and work to make it feel more acceptable for men to do the care work. And also, if by chance you had any thought about how a government policy could help make the link between care work and risk of violence. Either or both of those. Take it away.
Okay. I think it's necessary communication and the combination between the knowledge is more important. The studies, the academy, and the movements with combine the knowledge with the action, the social action. For example, in Uruguay was more important the study of the use of the time for the no pay to measure the no pay time, the tiempo no remunerado. You understand? It's very important to show what is the time in the home, the women and men. The knowledge is very important. For example, in the system care, we didn't know which is the measure of the people with a dependency. It's very important know this. For example, for the budget, what is the budget to attend these people? The combination with service, communication, knowledge, academic studies, and the dialogue with the social movement is very important to building a public agenda. The curve is not a decision with administration. The curve needs ¿cómo se dice en inglés? Densidad social, social convencimiento social, common social. Yes, it's very important. This is for the sustainability. The agenda of gender is a cultural change. It's not only service, or is a slow change. Mm-hmm. So the different actor must be convincing in this. Repeat, the knowledge is very important for that. Thanks.
Yeah, thank you so much, Gabriel. Great point about that the law is not just to provide services, but to help change culture, and that these communication styles you're talking about are a key way to do that. It feels a little cut short. I'm sorry for that. I'll continue to work behind the scenes and answer some of the written questions, but in the interest of time, over to you, Gary, for the concluding remarks.
First off, I want to thank all the panelists for your contributions and work on the different research and initiatives that you shared with all of us. Thanks very much for making the time for that. I also want to thank I want to do a couple of thanks before a couple of wrap-up remarks. I want to thank Apta Garg and Impo Mabhena, Apta from the Promundo team and Impo from the Sonke team, who are the global co-coordinators of MenCare and make all this information available and set this up. I also want to thank from Promundo's team and our comms team, particularly Alexa Hassing, Kelowna Manick, Roma Richardson. I want to thank Mamie Lee as well. And I want to thank all the Oxfam US team who did a fabulous job, and it has been a pleasure working with their research and comms team for this. I'll pull up a couple of slides if we could at the very end, if Apta you would pull those up. Just want to make a couple of comments. I think what we see as a takeaway from this research, as Fatima articulated so clearly, is that there's some good news here. Men are doing more. They're stepping in during COVID. The challenge, however, is that the overall care demands and needs have increased even greater than men are participating. So we've got to close that gap. It is both either good news or bad news that we see everywhere a kind of care perception gap, that men say they're doing more than women say that men are doing. And so now I can see the good news for that is that men think this is important. We are shifting the norms, as Gabriel just suggested. I think the challenge is how do we get men to do as much and support men to do as much as they say they're sometimes doing. I think we heard again and again how important it is to do, as the slide shows here, this mixture of the cultural norm change that we have to do to see that care work is neither male nor female, it is human, and that all of us should do it. How do we start even earlier with our sons and daughters from early ages onward to make that cultural shift? Engage media, engage the workplace, engage the power we have of policy to change those norms. We have put out, and as the slide here shows, the MenCare, the 50+ countries that participate in MenCare, trying to promote this shift. If we get men to do an hour more per day, we could make tremendous differences in terms of what equality would look like in the home. But that also means that governments have to take seriously that men should be doing 50% of the care. And I want to end on a point that it is a troubling, but I think it's also a hopeful moment of where we are these past few years. If we look at the power of Me Too as a global wake-up call to call men out for harm and for violence and for harassment, what the Black Lives Matter movement has meant in the last weeks in the US and in other parts of the world, questioning legacies of racism and colonialism, I think that care fits as part of this equation to say, we've got to continue to call men out. We've got to continue to call out leaders who don't take seriously inequality, but care gives us something to call men into. I think we see care as there's no simple anecdote in terms of violence and domination, but it does allow us to call men in to something different, to trade domination and aggression for care and love and connection. And that's what we'd like to end on. If you'll pass the next slide up we share with you, and one more, I'll pass on to the next one. Join us, please, in calling men into this, how we can all care, how we support caregivers, parents of all kinds to thrive, not only in COVID, but as Fatima so clearly said, to be even better as we emerge from this. And that's really what we aim to do with MenCare and with the How I Care campaign, together with Oxfam and Promundo. Thanks for all of you. Please follow it, add stories. We do believe this is an opportunity that we can promote positive change that lasts beyond this moment of COVID. Thanks for all of you, and we'll end it there. The event is recorded, and please join us in adding your voice to this campaign. Thanks again to all of you.
Thanks so much.